Good afternoon and welcome to Webinar Wednesday. Today we are joined by Travis Horstman, Territory Sales Manager and Biomedical Advisor at RLDatix, and Dustin Smith, Senior Director at Industry Solutions at Nuvolo. Just wanted to quickly add to say congratulations to Dustin for being one of TechNation's 40 Under 40 award winners. Well deserved, Dustin. Webinar Wednesday would like to thank our sponsor, RLDatix. OneSource, part of RLDatix, is a web-based solution that allows healthcare staff to easily access instructions for use, cleaning protocols, service manuals, and safety data sheets. They partner with medical instrument, device, and equipment manufacturers to provide you with 24/7 access to updated manufacturer documents, so you can meet accreditation standards from regulatory bodies such as the Joint Commission, CMS, OSHA, and many more. For more details, please visit rldatix.com. Just a quick reminder to save the date for our fall MD Expo. We're headed to the Caribe Royal Hotel in Orlando, Florida from October the 29th to the 31st. Please join us for 3 days of education, networking, and the latest advances in medical technology products and services. Registration is now open, so for more details, please visit mdexposhow.com. Today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once you've submitted the survey. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our wonderful Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. RLDatix, our sponsor today, has its American headquarters in Chicago. What is Chicago's nickname, or what is it commonly known as? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A. So please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Travis Horstman and Dustin Smith, and they will be discussing meeting your compliance needs with RLDatix, OneSource, and Nuvolo Integration. Travis, you may begin whenever you're ready.
All right, thank you for that introduction. My name is Travis Horstman. I work with RLDatix. And today's webinar is meeting your compliance needs and requirements is the basis. So before we start, we have a short poll question. If Linda, you wanted to go ahead and prompt that poll question.
Yep, it's now there. So how many of you feel that you have a good grasp on what compliance is and what it means to be compliant? So I will give you a chance to place your votes, and then I will close the poll. Okie doke. All right. So you have 45% saying yes, I believe I have a good understanding. 55% say sort of, but not completely sure. And fortunately, 0%, no idea, help.
All right, well, thank you. And thank you everybody for participating in the poll question. I'd like to start off by just introducing myself and what the webinar is going to be about. So we have a short introduction where we're going to introduce myself and Dustin, and then we're going to go over what is compliance and how RLDatix addresses the need for compliance. And then we're going to go through streamlining workflows and checklists with Nuvolo and cover the RLDatix and Nuvolo integration and kind of the real world impact. And then of course, we'll have a short Q&A session at the end. So to introduce myself, my name's Travis Horstman. I've been in healthcare for just over 14 years. For the first 7 of those years, I was an Air Force certified biomedical equipment technician. Since then, I transitioned to inactive duty with the National Guard, and I work in cybersecurity for the National Guard. Within OneSource and RLDatix, I've been with this organization for 8 years now. I started in operation and I transitioned to more product and sales focused roles. And I'll go ahead and turn it over to Dustin to introduce himself as well.
Thanks, Travis. So I'm Dustin Smith, Senior Director for Industry Solutions with a focus on healthcare at Nuvolo. I've spent my entire career within healthcare. I was just shy of 14 years with Intermountain Healthcare, where I held a variety of different roles, largely operational and analytics driven. And I finished my career at Intermountain as the Director of Central Support with Healthcare Technology Management. And so that's kind of given me my background where I can support Nuvolo in meeting the needs of healthcare. And so really excited to be here today with Travis to show you one of the many ways where we're looking within the industry to create a better together story. Travis, back to you.
All right, thank you, Dustin. That was great. And like Dustin said, the whole purpose of this is to help you meet compliance needs and understand compliance, and then work together, because we're all better if we combine solutions and integrate them to make a safer together message. So I want to go over, what does compliance mean? So remaining compliant does help organizations reduce waste, prevent fraud, standardize workflows, reduce costs, and increase Medicare reimbursements and promote patient safety. But what compliance really means is that you're adhering to regulations and really using best practices within your organization. So the Joint Commission has several different areas of compliance. I feel like compliance is not as important to BMETs as it should be, but through inventory management, performance and safety testing, maintenance of life support equipment, risk assessments, performance of and testing of all sterilizers, and environment of care are all aspects of compliance that impact a biomedical equipment technician. And what that means is doing the proper inspections at the proper time, managing your inventory, and just adhering to make sure that you're providing the safest care possible to your patients and staff. Just as an example of some compliance standards, these are elements of performance that are used within the Joint Commission. Elements of performance outline the standards and expectations for healthcare organizations to ensure the safe and effective use of medical equipment. Here's some examples that touch a BMET's life. If you are using the Joint Commission, your frequencies and inspecting and testing and maintaining the following items must adhere to the manufacturer's literature. So whatever the manufacturer says, you need to perform those proper procedures and inspection frequencies. So if the manufacturer's literature is telling you to perform this inspection on this frequency cycle and you don't have the proper documentation or the proper manual for that device, that could lead to a non-compliance status when you're inspected by the Joint Commission. And we do have another poll question before I get into OneSource and kind of expand on how OneSource impacts compliance. If you wanted to go ahead and present that poll question, Linda.
Yep, okay, it's available. So are you familiar with OneSource and what the platform does? Just give a few more seconds and we'll close it out. Okay, closing it out, Travis, and we have 54 saying yes, 15% saying no, and 31% heard of it but not sure what it does.
Okay, great. Well, it sounds like we have a kind of variety of folks that have heard of OneSource and kind of how we're trying to work together to help improve this compliance piece specifically, and really empower organizations to perform and adhere to these compliance standards. So compliance is not only something you worry about during your Joint Commission window or when a survey comes up, but it can be an everyday thing. So you know you're accessing the proper materials and information, and really empowering the newer technicians that are coming on to do the proper maintenance and teach them how staying compliant is essential and necessary to manage assets and equipment. So this slide here kind of just shows you how does RLDatix address compliance, and I'll get into OneSource in a second here, but we remove the burden of procuring, maintaining, and organizing your manufacturer's documentation. Many times I've talked to several different healthcare organizations, and a lot of times they may have a shared folder or a shared drive somewhere that BMET's kind of put the manuals that they've acquired throughout their careers. This crowdsourcing method can lead to non-compliant risks, of course, by using older manuals or using manuals that have been manipulated in some way and don't come directly from the manufacturer. So with OneSource, it's essentially a globally shared library of up-to-date and current manufacturer documents. We reach out directly to the manufacturers, validate the documents, and then keep them up to date within our database. So anytime you access a document on OneSource, you know it's validated from the manufacturer, and you know it's up to date and current. So you're not left wondering, is this the most current version? And a lot of times you may have to call the manufacturer to make sure that the manual you're using is up to date and current. It does help elevate the skill set of existing and new technicians. Specifically, I've heard rumors that technicians will be more needed in the near future. So as you're hiring new technicians, this is really a way for them to learn and use the proper methods for maintaining and meeting those equipment standard needs. And of course, we are a safety resource, so we started as a resource to improve safety, but we're built around those accreditation standards of having all of that documentation up to date, available, and current. So you will meet the compliance standards across all of the surveying bodies regarding manufacturers' documentation. And we continuously update our workflows and processes. This integration with Nuvolo, we're very, very excited about, because we do like that safer together approach to make the product more usable and more accessible to not only clinical staff, but also maintenance staff. So this is something that we're really excited to showcase. And another important part is OneSource does also integrate with Policy Stat. That's the RLDatix policy management software system. So when you're issuing a policy for a crash cart, for instance, you would be able to attach an actual instruction for use document or a procedure guideline from OneSource directly to Policy Stat without having to navigate through, similar to Nuvolo. So we're really trying to just give you the tools to make your job easier, so you can do more with less, and keep that compliance always compliant with your surveying bodies or other organizations. And so I have a short OneSource demonstration that I'm going to show. So just some benefits of the integration with Nuvolo. So it's a seamless connection to OneSource without having to log into multiple platforms. So from your CMMS system, Nuvolo, you're able to kind of quickly access those documents. If you were out in the field and you were somebody said, hey, we need this piece of equipment has a problem too, you would be able to quickly through Nuvolo access the manufacturer's documentation, maybe go to a troubleshooting section and kind of assess that situation on the fly. Up to date manufacturer's instructions and guidelines. This is what's inspected. You know, you want to make sure that you're using the most current, up-to-date manufacturer's literature regarding those. And you don't have to worry about storing or updating manuals anymore. There's ways to essentially build libraries within OneSource via Nuvolo to access all of your manuals at one time. And I'll show you that a little bit on the demo. And then updating your PM checklists and questions needed. I understand Nuvolo has a great system for this. You're able to access the literature where those preventative maintenance checklist questions come from, right in the same area and arena. And also another benefit of OneSource is we do obtain end of life and discontinuation notices on all the equipment that we ask. So we're operationally focused to ask manufacturers, is this piece of equipment still supportable, usable? If it's not, we always ask for a discontinuation letter or notice. And then we put that on the site so you have access to that. And once again, through Nuvolo, you can easily access all of that information. So now I'm going to slide over my OneSource slide just to do a quick demonstration before I turn it over to Dustin to go over Nuvolo, and he'll show you the Nuvolo integration and how it works. So this is what OneSource looks like when you click the integration button with Nuvolo. It'll essentially perform a search within OneSource already. But if you did use OneSource, you could also come to OneSource separately to do some research outside of Nuvolo if you wish. But the integration really does make it a lot easier to use. So the way you search, it's very simple to use. You can essentially search for anything you want, much like Google. So if you've used Google, you can use OneSource. Then you get a search result page like this. Within OneSource, we offer 7 different libraries of documents, depending on your subscription. And we work with healthcare organizations and independent servicing organizations to find the best fit of libraries that you'd like to subscribe to. But you can see we have several libraries. We have 7 total. Based on these search results, you're only getting 6 here. But you can add filters similar to Amazon if you've used Amazon. So if you're looking for a specific manufacturer, like I'm looking for this Mindray piece of equipment. I apologize, I must need to reload the page. So I'll just do another search. And then you can add a filter, Mindray, for example. Mindray North America. Now all your search results are related to this search criteria, only filtered by this manufacturer, Mindray North America. The categories are pretty self-explanatory. This favorites categories really helps you kind of stay up to date on your manufacturer's literature. So if you did punch out from Nuvolo and you accessed a manual, you could click this favorite button and tag it to a specific category. All you do is select the star. I have it in TH demo, but you could put it under a technician's name or a facility location or a vendor name. And you could store all your manuals and categorize them that way. You can also add any alternate names or notes. This may be useful if you wanted to indicate end of life on OneSource, and you could transfer that to Nuvolo. But it's just a good way to essentially store your manuals somewhere. All of our documents are downloadable. So once you access our manuals using this view document button, it brings up a searchable PDF. Our biomedical manuals do have these bookmarks, so you could go right to the maintenance section here on section 27, and it brings you right to the maintenance section of that manual. It's very useful to just essentially have a searchable PDF document that you know is up to date and current to go to the right documentation to find. If you had troubleshooting questions, you can go right to that section within the manual. And one of the last things I do want to cover on OneSource is we are looking to be a comprehensive resource for manuals. So if you ever come into a situation where you can't find something on OneSource, there's always this request document button. There's no charge for this. This is essentially a way for you to request us on your behalf to go get a manual for you, essentially. And it's a very simple process. You hit the request document button, you select the library that you're looking to add a document in. The biomedical library is our service level library where you're going to find those service manuals and preventative maintenance manuals. But you just fill out the information here. If it was an older piece of equipment, we do go after any piece of equipment you request. So if you had something from the 80s, you could request it. But if you weren't sure of the model or ID, you could always just upload a picture, essentially using this upload button if you'd like. It's not required. But once you click submit, that goes to our team of professionals. They facilitate that request, go out to the manufacturer, obtain the document, and put it in the system. So and our quality standard is 1 to 3 business days. And the folks doing those requests are real people, so you'd be able to have that kind of conversation with them and support to know where we are in that process. And the next section, let's say you've built those favorites and you wanted to go in and review your documents that you've built. You can go right into that TH demo account, and then you're going to see all of the documents that have been added here. In this LifePack 20, I just wanted to show you an example. So we do obtain the obsolete and end of life letters. It's a searchable feature on our site, so you can view the document, and then you'll have this product discontinuation notice. And this can be useful for capital planning management to make sure that you know what needs to be replaced, you know what's supportable, and really help you stay in compliance and do those risk assessments if you are using something that's been discontinued. And that kind of covers a very, very short version of the OneSource demonstration. At this time, I'm going to change presenters to Dustin, and he will take it from here. Let me change presenters.
Thanks, Travis.
You're welcome.
All right, so before we kick this off, similar to when we first started the conversation about OneSource, we're going to go through a brief survey to see who knows about Nuvolo.
Okay, Dustin, I'll give people a few seconds. The question is, are you familiar with Nuvolo and what the platform does? So just give them a couple more seconds. Okay, right, I'm closing the poll. You have 64% that said yes, 14% said no, and 21% said heard of it but not sure what it does.
Awesome, thank you. So with that in mind, there is familiarity with Nuvolo. So some of this may be a review, but it's also worth bringing up. So we are an IWMS system, so above and beyond a computerized maintenance management software or an enterprise asset management software, we do more. So that means we're covering cradle to the grave asset management. We're covering personnel, space and planning management with a native AutoCAD integration. So visibility to floor plans, which is very helpful, especially if you have RTLS. And then lease and rental property management. We have the ability to manage your projects from a capital request all the way to closeout. And then lastly, field service management. So our dispatching capabilities, that's going to assist any of your groups that are supporting regional areas. So think like imaging, sterilization, dialysis, or other traveling teams. Today, we're here to talk about compliance, okay, and streamlining workflows. So everything that Travis showcased so far, what's critical to understand, the information is up to date and it's coming from the manufacturer, but actually showcased by OneSource. So why is this important? When it comes to your elements of performance and conforming to the original equipment manufacturer expectations, stuff changes with time. So within Nuvolo, one of the things I will showcase is you have the ability to put in place these checklists that are going to guide technicians through the PM procedure, which is awesome. But if you have access to OneSource in a very simple and meaningful way, then we may not actually need to have technicians fill out every single one of these questions. So we can actually expedite the work order closure experience for our techs, because at the end of the day, I am yet to meet a technician who's in their role simply because they love filling out paperwork. It just doesn't exist, and it's not what our technicians are focused on. So to understand how we can make this easier, I have a PM that's outstanding and assigned to good old Abraham Lincoln. And it's against that same model that Travis had showcased earlier. But when Travis first got into OneSource, he actually had to search for that model in order to showcase the information to perform the PM. Where the Better Together story is helping both of us out is through this very simple button. So I can go through and leverage one of these checklists, okay, that's going to guide technicians through the procedure, or I can take advantage of the relationship my organization has with OneSource and get directly out to the most up-to-date instructions about performing this PM. So I'm simply coming down, hitting maintenance, and now I know what steps need to be performed, and it's more robust than the checklist that I have stored within Nuvolo. So there's an opportunity here. I could have my questions and responses be significantly smaller to expedite our technicians' maintenance of performance of the PM. Okay, so super easy, hopped right out to OneSource directly from our work order. And if desired, I can still leverage a checklist to store the results of that PM. Okay, so powerful stuff at the end of the day. And there's even more to it, right? So Travis had talked about end of life and end of support and capital planning. When we think about the importance of that within the context of Nuvolo, I can very easily articulate, is a device end of life and is it end of support? And one of the big questions, going back to the original response in regards to compliance, 55% stated they sort of know compliance. Okay. End of life and end of support life. This is one of those areas where occasionally people are asking, what's the difference? Okay. So end of life is when a manufacturer is no longer producing a device. Whereas end of support life is I can no longer get parts or service. This is critical when we think about our capital planning activities and also the training we provide to technicians, because if an end of support life letter comes out, we're not going to send a tech to training. It doesn't make sense. We're no longer going to have that equipment in our environment sooner or later. With this in mind, so we can pull that information down from OneSource, as Travis alluded to earlier, and then we can take that information and ingest it to assist with our capital planning process by creating a composite score of other ancillary factors impacting a device, whether that's our cost of service ratio, mean time between failure, or even is this a high risk device? And this information is being fed naturally through Nuvolo during our regular corrective and PM work orders. All of it's coming in, but we're also getting the benefit of that information coming from OneSource. Okay. As we're digesting that information and thinking towards the future, what do we need to focus on buying? Okay, so this is where that capital plan becomes critical. And here I have visibility to what my needs are based on department. I can also see this based on our manufacturer or age, and I can start fine tuning my capital plans to replace the right equipment, because no organization out there is going to be able to replace everything at once. So we need to prioritize. That's the point of capital planning, right? Because we're trying to manage limited capital budgets, but replacing what's needed instead of getting our third Da Vinci for one site that's underutilizing the first two. Along these lines as well, I can start manipulating my priority or anticipated replacement year with time so that it's not a stagnant or stale process. I'm thinking towards the future and appropriately documenting that so I can share it with not only our clinical teams that will benefit from using the equipment that comes in, but also financial teams as necessary so that we have visibility and we can appropriately prioritize. Also worth noting, our focus of the conversation today has been on compliance. Okay, so you have access to the appropriate OEM manuals to ensure that you're following the right PM procedures, but how do you measure that? And this is one of the areas where Nuvolo really shines. What we have in front of us right now is an environment of care report that we could potentially showcase during a regular EOC meeting, or we could export it so that people understand how are we doing in regards to our PMs. Are there certain devices that we could not find, unable to locate, or could not locate, or devices that were in use on a patient? Also worth noticing is, do we have training issues? Travis also brought up instructions for use. How many times have you gone to respond to a corrective work order only to learn that a clinician has no idea how to work with a specific device? You can leverage reports to prioritize your training and get people on board with how to leverage equipment appropriately so that you stop responding to meaningless corrective action. Also worth noting is visibility to recalls. And all of this information is showcased in a way that we can drill into and focus on to enable our success. So whether or not I'm a lead and I want to focus on specific departments while having certain conversations, a manager of a particular site, or even a system director, I've got the ability to kind of fine tune my reports on the fly and get the information that's needed. So going back to the beginning, right? Compliance is largely about enablement, okay? Do people understand what needs to be done, and do they have the tools to get that work done? That EOC report was the outcome of technicians delivering the appropriate action. And that's facilitated through enablement and the appropriate information. So again, just to largely close out our demonstration, I hit that OneSource button and I'm back to the appropriate documentation that's up to date for my PMs. So I've given technicians the visibility to the procedure set needed in order for them to be successful. And with that, Linda, I think we'll open it up to questions.
Okie dokie, we've got a couple of questions here. The first one is, what are some risks if a healthcare organisation does not remain compliant?
Yeah, do you want to take that, Travis, or you want me to?
Well, I can go first. I think it's valuable to have both of our inputs on this, Dustin. One of the risks of not remaining compliant is it can cost your healthcare organization funds in terms of not complying to certain CMS standards. You could lose certain federal funding that's related to that. So the risks can be pretty severe in terms of monetary value. You could be cited, you could lose your accreditation. The list goes on and on. One of the main risks of not being compliant, I think, is just patient safety. If you're not compliant, you're not. Those compliance standards are in there for a reason, so you can provide safer care to your organization as a whole. So, in terms of the risk, the real risk is patient harm, I feel. Dustin, did you want to add your take on that question as well?
Yeah, so I think you did a phenomenal job responding. The only thing I would add, and it goes back to kind of that first question where 55% stated they sort of know compliance. That response to me implies that there's a lot of text on the call, which is cool. And when it comes to compliance, if you're not compliant, that's when, unfortunately, somebody's breathing down the back of your neck and you're having to quickly respond to certain questions that may be outside of your typical scope of work. So staying compliant gives you the time back to focus on what's important.
Okay, another question here is, how does OneSource keep manufacturer and PM frequencies of equipment updated?
Thank you, Linda. That's a great question. The way that OneSource works is we are in contact directly with the manufacturers, and we obtain the documents directly from them. We're operationally focused, so we have a large operational team of former medical professionals that look at the manuals and go through them and pull out the specific frequencies indicated by the manufacturer's literature directly, and we put them in that column on OneSource. It was a PM frequency column. So we'll put the updated frequency on there, and that's strictly based off of the literature. So it's directly related to what the manufacturer is saying, and that's how that's done. So thank you for that question. That was a great question.
Okay, Dustin, do you want to add anything else? As we
I'm good.
Okay, great. Well, we haven't actually got any more questions come in. So as you can see from the screen, Justin and Travis's email is there. If you have any further questions that you think of after the webinar, please contact them directly. So thank you, Travis and Dustin, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit today's sponsors' website to learn more about the products they provide for the industry. So please visit RLDatix.com. As promised, the answer to today's trivia question is the Windy City. So congratulations to our winner, Michael Maps. A quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you once again for your time today, and I hope you enjoy the rest of your day.
Thanks, everyone.